Well, Leland, Congressman McEachin met with the president of Bon Secours' Richmond Community High School. This is the location, hospital, which is the location that's been at the center of a national controversy. He says after that meeting, it is now clear to him that Bon Secours has been, quote, abusing a federal program that's meant to help low-income communities like the East End. Feeling troubled and concerned, a federal lawmaker demands answers from the healthcare system, Bon Secours.
It saddens me, but it also makes me very angry.
Congressman Donald McEachin, who represents Richmond on Capitol Hill, met with Brian Lee, the president of St. Mary's and Richmond Community Hospitals, following a New York Times investigation. That report says Bon Secours raked in hundreds of millions in profits through Richmond Community Hospital, while simultaneously slashing critical support and equipment from that very hospital.
The notion that they have no real ICU is beyond my understanding. So the lack of those type of sort of basic emergency type services at a hospital like Richmond Community is unacceptable, completely unacceptable.
McEachin says the explanation they gave for cutting resources is that Richmond Community didn't need those services due to a lower volume of patients.
But I found their reasoning wholly insufficient.
The hospital serves a community in the city's East End, which is majority black and low income, factors that medical experts say put people at a higher risk of poor health outcomes. Richmond Community qualified Bon Secours for a federal program called 340B, which allows hospitals that serve low-income areas to buy medication for much lower cost while still billing patients and insurance companies close to the full price. The incentive is that Bon Secours would then invest all those savings back into the facility and the community, but McEachin says that's not happening as it should.
That money doesn't flow back to Richmond Community. It goes to the other hospitals like St. Francis and St. Mary's.
McEachin has now sent a letter to Bon Secours demanding that they fix what he calls inequities in health care access.
It's just another example of poor black folks being taken advantage of. You can quote me on that.
Now, in response, Bon Secours says that they were grateful for this meeting with Congressman McEachin, and they say they will remain committed to ensuring access to high-quality health care and meeting the needs of the community.